The tiredness was hard. And again, there would be times when I didn't get out of bed till 3 o'clock in the afternoon. But I did, and every day, makeup on, got dressed, even if I wasn't going anywhere, because my heart inside of me said, if you look good, you're gonna feel good. And nobody has to know that you're not feeling well.
I would work most of the day, and I'd leave around 2 and go to the oncology office, have my chemo, and come back to work and work the last hour, hour and a half. And there was only one time that I was not able to go back to work due to the nausea. And they were very flexible with me and my time. They never docked me for time. It was just an understanding. I would go get chemo and come back to work.
Unfortunately, some companies either can't do that because of their policies, the kind of company they are, the type of work that it is. And in those situations, it can be much more difficult for the employer to find some way to moderate the workload or the schedule to fit this person's treatment schedule.
The majority of cancer treatments are given in outpatient offices. Patients are not admitted to the hospital for these therapies. And the therapies are relatively short-lived. There's usually a plan to use treatments, depending on the setting, anywhere from 3 months to a year. And these treatments are intermittent. And if things go well, and often they do, depending on the circumstances, the therapies are then completed.
My husband would go by work and would pick up, whatever materials I needed and would bring them home, and I would do them from home. And my supervisor was very understanding of that and supportive of that, to the point that she just wanted to make sure I wasn't overdoing it at home also. But to me that was great, because I could do a little bit and then I could go lay down, and if I felt especially good on a day, I might do a little bit more than another day, but I had that flexibility. And I didn't have to get dressed to come into work and make that trip in and the trip home.
So I would get up first thing in the morning, the normal time, and get dressed, get the wig on, get the makeup on, go off to work, be at work by 7:30, 8 o'clock, and by 10 o'clock I'd be totally, totally exhausted. And I'd look at the clock and think, how am I ever going to make it to the end of the day?
When I came back after the radiation and the chemotherapy, my manager came to me and asked me, was there anything she could do to make my job easier? Did I need a place to lie down? Or if I thought I would need rest periods above the normal that you're allowed. And so it worked out very well. And she learned early on that due to the fatigue I had afterwards, that usually at lunch I would go to the car and take a nap. And if I wasn't back in an hour, somebody would come and check on me.
Sometimes there appear to be cognitive changes from some of the medications that patients have had to use. And we now know that for a minority of people, some of those cognitive effects are going to be prolonged. This doesn't mean they can't function, but it does mean that the person who's had cancer and experiences these cognitive changes may feel a bit frustrated when they go back to work. And they may recognize it's just a little bit harder to perform some of the mental tasks that they used to perform with great ease. And it takes some adjustment. One needs to evaluate the patients frequently, because they're certainly receiving serious forms of treatment that they may not all be able to work. Even though some are working, they may need some occasional time off, and they certainly have a good excuse for it.
A worker with cancer generally appreciates the support and concern of his or her fellow workers. And the cancer patient usually wants the relationship to stay as it was before the cancer diagnosis. It's also not unusual for coworkers to be uncomfortable with what to say and do.
The tendency can be for people to say, well, how are you today? In a different way than they would usually say, how are you today?
You don't feel very good, and after about the 3rd month, when they ask again how you're feeling, you get tired of saying, I feel fine, because they'll say, oh, you look great.
even if they just give the courteous fine, what went through their mind was an assessment of how they are, a fleeting bit of anxiety over having been asked the question, and then they either feel like they're lying because they say they're fine, or they have to tell you the truth, which is they're not. So why ask the question?
People in my life like to share stories about persons they knew that had cancer, and most of the time those people died, and they went through the big long tale of how that came about.
A few of our people sort of declared themselves emotional police, and they would try and manage other coworkers' emotional responses. And one lesson that we learned was that everybody has their own way, and as long as it's not impairing their productivity and their ability to just get along, that you leave it alone, because people are different.
The workplace is an environment where there can be many opportunities to do and say the right things, and sometimes unknowingly to do and say the wrong things. Here are some options to help managers and coworkers understand what is helpful and what is not. First, the helpful part, or the do's. When talking to a cancer patient, respect the person's choice about sharing information or being private, and if appropriate, let them know that you are concerned. Respect the person's treatment choices. Listen without feeling pressure to comment or give unneeded or unsolicited advice. Offer help at work or home in concrete and specific ways. Communicate your support in non-intrusive ways, such as sending cards or emails. Maintain your normal relationship with the person and keep the person's family situation and needs in mind. And here are some of the things that aren't so helpful, the don'ts. Don't offer advice about treatment options. It can cause unneeded stress or worry for that person. Don't break confidential communication. Don't overreact to changes in the person's appearance. Don't avoid the person or change your usual ways of relating to them. Don't assume the worst-case scenario. Half of all cancer patients are highly curable. Don't tell stories about other cancer patients or assume the person is unable to perform their usual duties. Don't pull away. Don't feel obligated to be the cheer-up person or rescuer. Don't try to make conversation if the person obviously does not want to talk. Don't keep mentioning that your coworker is courageous. That can create unneeded and unwanted pressure for them to perform.
When a person has been diagnosed with cancer and they are not able to work during treatment, they still need their coworkers. They still need the people who matter to them. Coworkers often aren't quite sure how to provide that support and that encouragement.
I think some of the best things that helped me along the way, and the absolute best thing, was the food that they provided. It helped me a whole lot to continue to provide nutrition to my family and to myself, which I really needed during receiving chemotherapy, and not have to worry about a lot of grocery shopping and preparing meals, etc.
There was one time when I went to Mary and said, you know, everybody wants to do something, what can we do?
It came to a point where there was no money coming into the home from my perspective. So my coworkers knew that. They, you know, again, were very supportive and actually organized, you know, sort of like a little fundraising in-house for me and my family. And they had bake sales. They sold lunches.
Everybody just got together. It wasn't a management thing. It wasn't a staff thing. Everybody just said, what can we do to help?